there for, this is my 4th year on the board. Eugene up there actually recruited me onto the board, and also gifted me the fabulous community advisory committee that I've been chair of for the past 3 years. And the reason that we've invited you along today is because we're starting our strategic planning for the period 2021 to 2024. So we have a bit of time to get it together, but it's really important for us to hear the voices of our stakeholders, to hear the voices of our community, and to hear the voices of, most importantly, our consumers, to make sure that whatever we're creating and building for the future, that we've got that consumer voice at the heart of whatever we're doing. We've got the fabulous Alison here, who's going to be doing all of the hard cards here. Hi, Alison. Michelle, did you want to take off that screen share so that we can all see each other just for the mo? Thanks, Michelle. And we've also got Michelle, our fabulous technical assistant. Oh, helping us there is organised it, and Ninja administrator. We've also got Ness joining us there, connecting, also having a little bit of, connected into audio. Ness is working with the City of Greater Bendigo on their Help Your Neighbour project, and we're delighted that she's just joined our Community Advisory Committee. You've been to one meeting now? Fantastic. So you've actually already met Alison and had a chat to her. Yeah. So this is our this is our opportunity to bring other people in, to hear what you say, to have a discussion, and had a very productive meeting last night with a big cross-section, a good cross-section of the community. We're doing same thing at different times to try and make it accessible for everyone. So I would be remiss of me if I didn't acknowledge before we start the meeting that I'm sitting here on Jara country, and I'd like to acknowledge the traditional owners, the Dja Dja Wurrung, and their elders past, present and emerging. And I'm sure that we're all coming from different places, the Tangarang if you're down in Heathcote, and Alison, you're
Wurundjeri in Melbourne.
Down in Melbourne. So with that acknowledgement completed, I think I'll just hand over to you, Alison, to do your and facilitate this session. Thanks very much. It's open discussion, open your mics and have a chance, drop in, tell us what you're thinking. We just really want to hear different people's opinions about how Heathcote House can better support the needs of our community in our strategic plan.
Thanks, Anne. So lovely to meet you all. My name's Alison Hallahan. I'm part of a small consulting firm called Biru, and I head up the health program within Biru. I've done some work with Heathcote Health before. I prepared the current service plan. It's probably getting a little bit old by now, but it's I think been a useful document for the health service for a period of time, and so it's a real privilege to be given the opportunity to come back and work on the strategic plan for the next 3 years. So a strategic plan is very much a high-level document. If you're interested, you can look up Heathcote Health's strategic plan on its website, and it's an A4 sheet. So it's really very much about saying, here are our priorities that we're going to be working on over the next period of time, and here's the things that we'd like to be accountable for. So it does a couple of things. Part of it is part of the conversation between the executive of the health service and the board. So the board is responsible for those strategic directions, and the health service and the executive are accountable to the board for delivery of those strategic directions. It's also a an accountability document with the department and with the community. It's a public document, and it's Heathcote Health statement to you as the community that says these are the things that we're going to be focusing on over the next 3-year period. So that's part of why it's Heathcote Health's very keen to include people from outside the organisation in helping to develop it, because it's their commitment back to the community. And so my role in this is to lead those conversations, to pull it together into a document that then will go back to the board. It'll come back to community forums for people to look at and comment on. It'll go to staff, and over the next couple of months, we'll end up with a sort of final document that can go off to the department. So what we're going to do today is think through the things that are impacting on you as individuals, as members of organisations, as as employees, as employers, as community members. So the things that you see around you that you think will impact on the way that Heathcote Health works with its community over the next few years, and the way that it will work with strategic partners. I think, Shaz, you've got that link through to Bendigo Health, and that's a key partner that Heathcote Health needs to work with to bring their services into the community and help Heathcote residents get access to services in Bendigo if that's the right thing for them. We'll then have a look at the current list of priorities from the existing strategic plan, and that's just an opportunity for you to have a look at them and reflect on, do they look as if they're still important to you? Are there different things, new things that are important to you or that you believe are important to the community that Heathcote Health needs to be taking account of over the next few years? And then we'll talk a bit about resources. So what does the community need? What can the community put into that partnership with Heathcote Health? And what do you need from Heathcote Health in order to deliver on that partnership? You've given me an hour and a half, and I'll do my best. One of my jobs is to get us finished by 2:30. If we finish before then, that's okay. We don't have to stay till 2:30 if everybody's had the opportunity to say what they need to say. The other thing that we're recording this session. So does anybody object if we put the recording of the session onto the Heathcote Health Facebook page? We're using the Facebook page hopefully to start up a bit of a conversation with community members. If you want to think about that, have a think about it. If anybody objects, it won't go onto the Facebook page, but if you're all comfortable with it, it can go there so that other people can have a look at the conversation and can then use the Facebook page to reflect, respond, challenge, provide extra ideas. So it's part of keeping that conversation out there in public. So are there any immediate objections to that? We'll check again at the end, and if at the end, you think, actually, I don't want this on the Facebook page, then you've got an opportunity to say so. So I'm going to start by asking you to reflect on just what you see happening around Heathcote at the moment and how you think it impacts on Heathcote Health over the next few years. Last night we talked about the employment impact of the pandemic, the need for small business in the area to get its feet back on the ground, some of the mental health impacts on the community. So that they may be some of the things that you want to talk about, or you may have other comments to make as well.
I'm happy to go first. I don't live in Heathcote, so I might be speaking out of turn. But I guess my my interest in participating is around sort of making sure health services are engaging with and supporting volunteers. I suppose that's my primary reason for being here, which I actually know Dan does extremely well. I couldn't be more blessed to have him as a CEO rep on a project. So I'm quite confident about that. But I think that some of the things that are really going to impact is, you're right, business, rebuilding business, unemployment, mental health, and also the need for connection.
Yep.
I think that post-COVID, there'll be a lot of people putting down tablets and screens and actually wanting to meet with people face to face. So I think it's
absolutely.
that a health service, supports the need for that.
Sorry, just madly scribbling here. So that connection, I think in my relatively limited experience with Heathcote Health, but having worked with Heathcote Health before, it appears that there are strong connections, there are strong organisations within the Heathcote community that have really worked to link people together and help them to maintain those links. Do you think that's still the case? Are those social capital organisations still there, still strong? How are they coming through this last tough year?
I think Michelle will probably be better able to answer that question from a Heathcote perspective. But certainly, I know a lot of volunteer involving organisations or organisations that are reliant on volunteering have had to cease, and so services aren't necessarily being provided or aren't being provided in the same way. But add to that, the volunteers themselves are feeling a level of redundancy, and a lot of people see their value by what they do or rate their value by what they do. So I think it's really important that we find a way to reconnect them. And I think health services, are well positioned to do that. And as I said, Dan already does this, but I just, I'm just putting in my 2 cents worth.
Yeah. Oh no, that's important. Volunteers are a great part of the glue in communities, and that and work closely with health services. So it's important to know that they're what they need in order to get re-engaged. Vanessa?
Make a comment?
Yeah.
The volunteer organisations during the pandemic have mostly just stopped. So you've got Advanced Heathcote and the Bunbanarek, they've just not functioned because people can't meet. There's been some Zoom meetings, but they have been few and far between. So once we come to the end of it, there will really need to be a new energizing of those organisations to get them back up to speed, because they've been really hit by a tsunami. It's just sort of knocked them sideways. And I wonder too if some people will have become accustomed to using devices and catching up like this, and maybe they would want to continue that, especially in relation to telehealth. I wonder what's Heathcote Health's involvement in telehealth. I know that it used to be very keen, and there were a number of initiatives, but I think there might be even more of an appetite for it after we come out of this.
Yeah, it's interesting, isn't it, that all those years that people talked about telehealth, and at the beginning of the pandemic, suddenly within 2 weeks it was sorted. So those of you who are connected with people in the community, have you had feedback from people about how they've found that telehealth experience? Is it something that you think people will want to have, that they'll want to continue to have access to?
Well, my own experience is contacting with specialists in Melbourne and with GP in Bendigo, that it's certainly been their preferred method, because that's the number one option that they've been offering, and it's only face-to-face in exceptional circumstances. So I think that both the medicos and some patients, it'll be very convenient not having to travel to Melbourne or travel
Yeah, yeah,
appointment for a first up assessment. Yes, it'll have to be face to face, but especially places like Heathcote, where it's inconvenient and costly for some people, telehealth would be a preferred option.
yeah, yeah. Vanessa, you've been putting your hand up.
Oh, only a couple of things, Alison. With telehealth, both my husband and I have been utilising telehealth for services that we haven't found easy to access in Heathcote, and that's worked really well. So we will definitely continue using telehealth where we can. But we've also been engaging. He goes to the doctor at Heathcote Health, and I go to the doctor down the high street. So that's worked really well.
So it's a good adjunct to, you'd see it rather than
I think sort of I work with the City of Greater Bendigo both in economic development and community development, and I guess one of the challenges that we're looking at is how we going to help people reconnect to communities, particularly if there are sort of mental health issues. So we've become very used to talking over Zoom, and I'm catching up with my team tomorrow for the first time. I've never met them in person, and one of the ladies shared that she's actually very nervous. So I think there's a level of anxiety about moving back into face-to-face interactions in the community. And sort of the other thing that has really come to mind in Heathcote. So I've been working from home for 8 months now, and there's a lot of young people in Heathcote, teenagers as well. And I think that this is a very broad statement, but I think that cohort can be overlooked when we're thinking about community needs and engaging people. And from a health perspective, I just think it'd be really interesting to consider how, particularly teenagers,
they need their tribes.
Like I can't imagine what it would have been like in year 12, not going to the school formal and people's 18ths and doing year 12 online and being stuck at home with my parents. And I know that's had an impact on my colleagues' kids.
Yeah.
But that's all.
I think just on that, Vanessa, you've raised a good point for a health service. Heathcote is obviously an ageing community, so to engage some of those younger people into Heathcote Health in some measure may well prove to be very beneficial for encouraging more young people to get involved.
Yep.
Someone last night talked about the opening of childcare services in Heathcote. Have you seen impacts?
There's been a major impact. I'm involved with Heathcote Community Children's Association in Bunbury, which we built that childcare centre. It's been a really big impact. People being able to have their children cared for in Heathcote rather than having to go to Bendigo or else not go to work. It's been a major benefit, and for the and those people who use it really talk very positively about that service.
Yeah, and it's good to have you as somebody who's involved. How much is it linked with other organisations like Heathcote Health?
There was some attempt to make it connect with Heathcote Health by we got a program called Full Circle, where we were getting the kids to come up to Heathcote Health to meet with older people, a bit like that television program.
Yep.
Was it called Year 4 or something? So we did that, but that struggled a bit, and then we were going to revitalize that, and then COVID hit. But that was really well received. Everybody who was involved really liked it. We had a few hiccups, but those were being ironed out, and we will start it again at some point in the future. But that is one way of really engaging. And the organisation that runs the childcare, they were very keen to do that as well.
Yeah, great.
Our residents, I know, really appreciated that program and the kinder visiting program a lot.
Yes. Yes, the kinder really got into it as well. It was just a hiccup that needed to be sorted, and I'm pretty sure that's been sorted now.
Yeah. So the kinder and the childcare are the same organisation, provided by the same organisation, or are they different?
No, the kinder's an organisation onto its own, and and then there's playgroup, and then there's HCCSA, which was running its own range of services, and the maternal health nurse from City of Bendigo, and she's still, well, she hasn't been coming there now, but she will come back in the future.
Yeah.
So, and then that was linked in with Jenny's, which is the organisation, private organisation that rents the space, the big dedicated space for childcare.
Yeah. Because
So,
I think at either end of those spectrums, somebody mentioned the VCE kids, but also the little kids, that connection with peers is so important for them.
Yes, that's it, and for their development to be involved with others, but it also created an opportunity for kids that might be having some difficulties or struggles, because there was a connection there with the child maternal health. So, and there was an agreement with them and with Jenny's and with the parents that if the childcare centre saw any problem that needed an intervention, that they could request the maternal child health nurse to come in and review that child while they were playing with others and so forth. So really terrific opportunity. So it meant you didn't have to make an appointment or anything like that. It would just happen smoothly.
Yeah, and sort of almost under the radar.
Well, that's
stigmatizing the kid.
There was no big deal about it. It was just something.
Yeah, it's a lovely idea.
Yeah.
So just coming back to where Shaz started, and she was talking about volunteers, but she said that one of the impacts on people who are volunteers is, the impact of unemployment, presumably for themselves and their families. What's employment looking like in Heathcote over the next little while? You've talked about the need for business to be rebuilt, for some of those connections to be rebuilt. Are people feeling confident that will happen? I mean, how do you feel that Heathcote as an economic community is going to come out of this? Have you got the platforms for that, for people to get their job and for the community to start operating better on that level?
Again, I'm not a Heathcote person per se, but I guess at Bendigo, one of the things that we will be looking at is when we do get to re-engage people into volunteering, that volunteering is a pathway very often to employment or for education. And so, I think for my mind, health services have a role to play, not just in utilising volunteers, but supporting volunteers, because people are becoming far more transient now. They're not staying at volunteer organisations for quite as long, but I think as a health service, volunteering is a health initiative, and it can help in many ways. So whether it's connection, employment, education, I don't know, all sorts of wonderful things come from that. And I guess that's what I was leaning towards,
right, okay.
Health service taking a lead, taking responsibility, and supporting the community by having a robust volunteer program.
And so do you think Heathcote Health needs to partner up with other organisations to help that to happen? Would it be useful if Heathcote Health was working with, say, Bendigo Health, with the schools, whoever else is using volunteers as part of that strategy? I think
they already do.
Right, okay.
Certainly Dan as a CEO is very committed to volunteering. So we currently have a Loddon Mallee Health Network group, and we're doing a volunteer strategy, which Dan is
right.
CEO lead on. And, you know, he's also very committed to Heathcote Neighbourhood House. Like, he's established a lot of good relationships across the Heathcote Bendigo region and beyond. But I just think as a part of the strategic plan, I think there needs to be something in that really leads towards, you know, volunteering being a health initiative and supporting the needs of the community in a different way.
Yeah. I think that's really interesting. Some of the discussion, and Tony, I think you were there last night, and I don't know if you would reflect in the same way, so feel free to challenge me. Some of the discussion last night was around the mental health and wellbeing of people in the community, and that you know, it's been a really, really tough year, and it's not over yet, and that you know, there are many people who've lost jobs, who've had their lives really upended, either by being ill or, you know, by being affected by the pandemic restrictions. And so people last night were talking about the role of Heathcote Health in working to support community mental health and wellbeing. And they sort of, and the conversation went in the direction of services, you know, psychology and, you know, self-help groups and things like that. And I think that that's important, but I also think it's important, and I've been reflecting on this since, and so thank you, you've given me an opportunity to give it to you to reflect on, because you don't necessarily want to medicalise people's unhappiness, frustration, boredom, you know, the impacts of, say, unemployment. So you don't want to necessarily medicalise it. I mean, some people will need a service response, but many people are just going to need a job, and you know, that's going to sort it. They don't need a mental health service in a sense. And I think Shaz, you've really sort of pulled on that a bit, which I think is really interesting, that a strategy like the volunteer strategy helps to achieve that mental health outcome without saying, oh, we're going to sit you in a room and talk to you about your mental health and wellbeing. What do people think about that? Vanessa, you've got a comment? You've just muted.
Oh, no, I think you've just brought up a really great point, and it just sort of popped into my mind. Would you consider something around community resilience?
Yep.
And how you're working sort of with the community to build that,
yep,
sort of, so they can sort of batter the storm, and they may not, like, it's been a tough year for everybody. And like last week, must be 8 months working from home. Like, I hit a wall and I just went, I cannot do Zoom anymore.
Yeah.
But I'm going to have to, and I have to sort of.
But you have to.
And I'm really lucky because I've got some great support networks around me, and I don't necessarily need to see a psychologist about it. Got a business coach who's been amazing, but how are we helping people link into places that can help them build the resilience?
Yeah, and that's really about a whole of community response, isn't it?
Yeah, it is. But resilience and health, I think, are two sides of the same coin.
Yep. Looking at health from that positive lens rather than health.
Absolutely. Like, what are we doing? I guess maybe from a positive psychology point of view. Life tools, life skills, wellness. That's what I would see the direct link into health. So you've got less people, I guess, at the end point who are in really high levels of distress.
Yep.
Because what I've found is there's actually really incredible sort of networks and communities obviously in Heathcote, and if people are sort of facilitated to connect in ways, I've done a bit of work around this, but that helps resilience. Trevor and I are part of the SES, so we've kept in touch. Training being drastically changed, but we're just sort of starting to come back together. But having that that link-in point has been really beneficial to both of us from a mental health perspective.
Yeah. And that comes back to what Eugene was saying about a number of those organisations have just had to stop. because they haven't been able to meet, and their members haven't been able to, or haven't had access to these sorts of platforms. And so then the health service, I mean, one of the things that the health service has, Anne, did you want to come in on that before I...
Sorry to interrupt, so I just wanted to welcome Trina, who's just joined us from the DHS Aboriginal Support Unit. Thanks, Trina, for coming online to our discussion. It's great to have you here.
Thank you.
Hi, Trina. We're talking community health and wellbeing and resilience at the moment. So I have always thought that one of the roles of regional and rural health services is to help communities to build those platforms, and that might be just offering space for people to meet, giving people access to their Facebook page or their photocopiers, helping people to link up, using their volunteer networks to get people to link up. Is that the sort of role that you'd be expecting Heathcote Health to be playing over the next few years? Do they need to do more than that? Do they need to do something different to help rebuild that community network and resilience?
I think it's a massive opportunity. Sorry.
Okay.
No, it's a massive opportunity to maybe look at things in a sort of a fresh way as to the role of a health service in developing community resilience, because it's just got so many positive health outcomes, and that could potentially be through partnerships with organisations who are trying to achieve similar objectives, and obviously local government as well. I'm just thinking off the top of my head.
Yep. Eugene, you were going to put in a comment there?
It's in terms of resilience and organisations, the Men's Shed was a great initiative, but I assume that is dead in the water. The community house was another great initiative from Heathcote Health. But these initiatives or the organisations I'm involved with, like Advanced Heathcote, they give people a reason for coming together. They don't come together because it's going to improve their mental health, but
Yes.
Come together, you can make a contribution. Maybe you can contribute skills or manpower or do something good for other people as a kind of an altruistic thing, but you gain a benefit yourself. But that is not the reason why you come in there. It's that you get. And it's all to do with being human and being a social being, that you need to be with other people. And even if you just have a cup of coffee or say good day, or you maybe not even doing a great deal of interaction, just being with people supports mental health.
Yeah, and I agree. Nobody's going to come to something that says, "Oh, come to a mental health and resilience meeting." They're not going to come. But if it's come and work on this project together.
Yes.
I know health services. A health service in South Australia several years ago had a program for their Indigenous community, and so they started offering a once a month lunch. But it wasn't just a lunch, and it was for the elders. And what they did was they started setting up clinics. So the elders would come for lunch because they were confident to do that. They were being offered something. And then the local GP was there, and then the podiatrist was there, and then the dietitian was there. Yep. And so one of the things that it did was it created a community whereby the Indigenous felt safe, and they weren't afraid to come to a hospital. Yeah. So, there might be some opportunities that Heathcote Health has to have little open houses that can offer a level of education maybe for the community that supports whatever, the current need is.
Yeah. And that sounds like you're almost saying the hospital came to the lunch rather than the people came to the hospital or the health service. And that's a really interesting idea.
That's part of our hub for us to have people come and provide us with professional services or just a drop-in opportunity. Can't do it at the moment, but that's what we're looking at, to make that hub welcome area at the very reception point there. We're hoping that that's what that will be. So we're definitely across those ideas, but that support of that and the way in which that's delivered is really great idea, Shad.
Yeah. So I'm going to ask Michelle to share her screen so we can look at the list of current priorities. Now, it's really an opportunity for you to reflect on current priorities. When we're doing strategic planning, you know, it isn't expected that you stop everything you're doing and start doing something different. You're not expected to, you know, throw the baby out with the bathwater. If there's useful stuff that's currently happening that strategically it's important to continue, then we need to know about it. So once that comes up, I'd just ask you to, you know, when you look at the list of current priorities, what does it say to you? Are there things that that you think are no longer priorities? They've been done. Things that we need to continue to nearly there. We need to continue to be working on. There we go. So it's around community engagement, workforce, service delivery, obviously, because Heathcote Health's a service delivery organisation, governance, safety and quality. Any comments on, you know, what does that say to you? Would you do something different? Are there ideas or priorities there that you say, look, regardless of anything, you've really got to hang on to number whatever?
One thing I'd say, some of the statements on there are fairly obvious things that you should be doing. But for a long time, Heathcote Health has been seen by some members of the community as sort of an organisation that's somewhere up the back of Heathcote. People don't always know exactly where it is or what it does. And the board made decisions a long time ago to try and break that down a bit and try and get out and meet people. And that was quite successful. But I still think, especially for newer people, it is that people aren't exactly certain, what does Heathcote Health do?
Yep.
And there is an opportunity at the moment for Heathcote Health to show some leadership, particularly in relation to COVID-19, in terms of maybe helping people to remind people about the safety measures that are being implemented. Officer, or by providing leadership around you know, explaining to people why these things are necessary and what the risks are, and trying to create a community that is engaged with the process. It's not just something that happens in Melbourne, you have to follow it, and all those people down there don't know what we do up here. It has to be localized and seen to be important. And this is going to continue into the future, because we're not going to come to the end of the lockdown and everything goes back to normal, because we're going to have outbreaks and we're going to need local leadership.
Yep.
So there is an opportunity for Heathcote Health to become more engaged with the community and to be seen and to have a higher profile and to be seen to be important. And it is important because the Heathcote Health and the Mine are the two big employers in the town. So it really needs to maybe increase its profile.
Yeah. And that role as being one of the major employers is a really important one. Apart from just being a health service, they're actually, you know, a big economic player within the community as well.
Yep.
That's really interesting. Any other reflections? Does that bring anything up for any other people? Vanessa?
Yeah. I would definitely support everything Eugene said, particularly around the opportunities for Heathcote Health to amplify a lot more sort of stories and messaging around the great things that they're doing in the community and the services. So I think, I know you've got a lot on your website, but I think there's a lot of opportunity there for you to as I said, amplify the great work that you're doing. Also, in terms of jobs, I was just having a bit of a think. Rural towns, you know, face challenges around employment anyway, but I think Heathcote's in a fortunate position because we've got stable industries such as mining, relatively stable industries like the mining, health, education and agriculture. So tourism and retail and hospitality have obviously taken a huge hit, but I think we've got some great strength in the existing industries as well. So I don't think it's all a completely bad news story. And sort of the sense I'm getting in just dealing with businesses through work is with the right supports in place, they will bounce back. It's like not everyone will bounce back, but I think people are a lot more resilient than what we give them credit for. And yeah.
Alison, Tony Hunter. I could be on the wrong track here altogether, but I mentioned yesterday at yesterday's meeting that the importance of the dementia centre and the impact that that would have not only on Heathcote but on Heathcote Health particularly, and developing strategies for Heathcote Health. The dementia centre is going to have an amazing impact all across the board, and particularly to Heathcote Health. So I'm just wondering whether that couldn't be, the advancement of that dementia centre couldn't be or shouldn't be part of the strategic goals of Heathcote Health. Eugene might have some comments here, because I think, Eugene, you're on a steering committee, if I'm not incorrect, to advance the dementia centre. But it seems to me that Dan Douglas, who was one of the original drivers of this for Heathcote, sort of has been sidelined a bit and doesn't seem to be asked to be involved as he originally was.
Can I just comment on that, Tony?
Yeah.
Dan has been a terrific influence on that whole development. Dan needed to, and this is Dan's own initiative, he needed to sort of step aside from it and step off Advanced Heathcote once Heathcote Health relinquished their role and handed over to Advanced Heathcote. We're still very keen to get Dan's input, and we asked for Dan's opinion, and it is very much valued. But I agree also with you that Heathcote Health and the Dementia Village are really two parts of a whole, and they'll be interdependent, and one needs the other. And Heathcote Health continues to have input to the development, because they will provide services and they'll provide expertise that the Dementia Village will be reliant on. And the Dementia Village will provide a whole lot of new resources, which will be very valuable for Heathcote Health. So,
because if you look at the major employers within the Heathcote community, being, I guess, the trailer factory, the mine, the wine industry, Heathcote Health itself, there's probably, I can speak specifically from the wine industry's point of view, there's not going to be, I don't think, a lot of growth in employment in the wine industry. There's not a lot of new planting going on, so the existing level of grape production is probably going to stabilise. More and more wine businesses are relying now on cellar door, and that's good, but you don't need a large number of people to operate your cellar door. So I think the wine industry is going to be limited in terms of employment opportunities. The mine is, I think, is a big employer, but it's probably not going to grow greatly. Same applies to to Heathcote Health, for that matter, and also the trailer factory. So basically, I'm sort of painting a picture there of very few new employment opportunities being created. This is where I see the dementia centre as being so critical, because that will be a major employer. Initially probably 100, 200 people, and across all ages. So this is my favourite hobby horse, of course, and I keep mentioning it, but to me, it's just the absolute key. It's the tipping point for the whole of Heathcote.
I agree with you, Tony, and it will create enormous opportunities initially through building and architecture and all that development, and then eventually there'll be people's careers will be able to be developed and established through allied health and even through medicine and through research and through education. Yes, it will be just phenomenal. It's a matter of that getting advanced to the point where a funder can be found and somebody who would run the service. So that is work that's progressing. It's slowed enormously by COVID-19, but it is progressing.
Yeah. Yeah, I mean, I think it's kudos to Heathcote Health for the, like they've really been, they've maintained the focus on the dementia village for a long time, without a lot of support from the department at first, but obviously they've turned that situation around.
Well, the department is, certainly the state governments don't see aged care as being their focus. They see that as a Commonwealth responsibility, and the Commonwealth prefer to see it being operated by the private sector. So they'll be go around in the circle.
Yeah, it'll be interesting to see if that changes with the Aged Care Royal Commission.
Well, that's the other thing that's going to affect everything. So what recommendations and particularly around staffing, what is that going to do to the
So can I just draw your attention back to the existing strategic goals? Any other comments about those goals and how we see them as a launching pad into the next strategic plan?
So, Alison, just from an observer's point of view, and I know it happens with a lot of strategic plans, but they seem very dry. I think needs to feel like people own it, or they, it belongs to them.
Yeah. So I think what you're saying is that the spirit of them is good, but they need to be a bit more
user-friendly.
User-friendly. That's a very good way of putting it. Yeah.
I fully agree with that. That it is a fairly dry document. And we do know something about the demographics of Heathcote, that it's got a much older population than Bendigo, so average age is around about 56. And we know that age group is much more at risk and has more of chronic mental and physical health conditions like diabetes, like cancer, and I just wonder, given we know the demographics and given we know what sort of treatments are available, what early interventions, how are these two things brought together, the people who are affected and the people who are providing the services?
Yeah. And hopefully we can craft up a strategic plan that helps to make that connection a bit more closely. Yeah. It's a challenge. I don't want to sound like I'm dissing the people who worked on the last one.
Those strategic goals are very generalised. Would it be appropriate to be a bit more specific with those strategic goals, i.e. advance remote monitoring of people's health, pushing that forward as a strategic objective, telehealth, expanding their aged care capacity, so that they can, so that Heathcote Health can have more aged people involved directly with them.
Yep.
So quite, more specific targets or objectives and strategies rather than very generalised, such as services are delivered effectively and efficiently. I think that that almost goes without saying.
Yeah, yeah. I mean, it is a challenge, and I think you've hit the nail on the head of how to make them specific enough that people can connect to them, but not so specific that they can just become obsolete in a year or so as time changes. And I think the real challenge just at the moment is that, obviously the pandemic is a huge impact on everything that's happening at the moment. And we do need to make sure that the strategic plan helps Heathcote Health to work with its community to get to the other side of this. But the strategic plan shouldn't be so focused on the pandemic that we lose those other things. So it's that's part of the reason of having these sorts of conversations, and also with staff.
I just say in relation to this, something that's missing is around early detection and early intervention. Because get more bang for your buck than anything else. You can put in very good services down the line when a disease is established, but if you get in very early, you can make a big difference to the outcome and the trajectory of that illness.
Yeah. It's better for the health service, and it's better for the person.
Yes, indeed.
Yeah. So, so finally, we need to think about resources. And it's interesting, who was it talked about leadership? I think it might have been you, Eugene, so I'm going to come back to you. Leadership is obviously a resource amongst other resources that exist within the community. And I agree with you that part of the role of a rural health service is to demonstrate that community leadership. Do you want to add anything more to that? Are there specific things that you'd like to see the health service focus on, in partnership, obviously, with the community, with other organisations, around that leadership role?
Well, it could use the resources of other organisations by bringing together, by creating a forum or creating a focus for other organisations to collaborate and cooperate in delivering the sort of goals that Heathcote Health needs to be delivered for the community. So you could start just identify what are the organisations that are out there. For instance, in dementia, there's several organisations in the state who are looking at, who are running research and trying to get early detection of dementia and providing people access to new treatments. So this wouldn't cost a lot of money. It would be something that would be an advantage. But often people in the community won't even know these things. They wouldn't know to contact an organisation to say, I've got somebody who's got early stage dementia, and what are the new treatments? What are the research strategies that they can be involved in, and how much will it cost? It probably won't cost anything.
Yep.
But Dan's already across a lot of these things, and he knows organizations, he knows the people. So, and I think that in terms resources is the issue. Dan is somebody who seems to have an enormous capacity for work. I don't know how he manages it, but it's just his time's got to be limited, though.
Yeah, and the other thing is that over the other challenges that the health service, as well as other organisations within Heathcote, are going to face over the next little while, is that resources are going to be scarce. If we go into a recession, that just means there's less money around to throw at any of these problems. So we need to be more creative, better able to do more with what we've got, and more alive to what are the jargon term is the in-kind resources. Where do you find the assistance from individuals or from organisations that works in partnership, and you don't have to find money for it.
Yes,
So
that's true. But I wonder if this situation would motivate people in particular ways, knowing that there's a recession looming. Is there a way that it would motivate people? I'm not sure how that would happen, but is there opportunity? Is there something that we're not seeing because it's just we're so close to it?
Yep. I've got a few people on mute, so I'm not sure if they're sort of sitting back at this point or just not sure that they can put their voice in.
Sorry, I took myself off mute because I had a bird squawking in the background.
Okay.
So I'll keep it on, but I agree with everything Eugene's just I think the issue will be for Dan in that the strategy doesn't become so big and overwhelming that it's impossible to actually, get across the line.
Yep. That's.
If you burn him out, you're not going to get, good CEOs like Dan all the time. So you don't want to burn him out too early.
Yep. All right. So we've. I don't need to close up immediately, but I feel that we're sort of getting towards the end of the conversation. Before I do close off and hand back to Anne to finish off the discussion, have any of you come to this meeting with something particular that you wanted to say, and I haven't asked you the right question that's allowed you to say it? So this is a last opportunity for random or not so random comments, thoughts, ideas, questions before we finish off. I'd hate to think that anybody went away and thought, I wish I'd had the opportunity to give my great idea. If you do go away and if you're thinking about it or talking with friends later and you think, actually, I do wish I had said X, Y, Z, I think people can get back in touch through you, Michelle, and she'll make sure that your thought, your idea, or your friends' thoughts and ideas. So if you're talking to somebody who says, I didn't know that was on. If I'd known, I would have come because I wanted to say, make sure that they understand that they do have an opportunity to do that. Keep an eye on the Facebook page as well, because we'll try and keep this conversation happening through the Facebook page. One of the things that, and hopefully if the restrictions open a little bit, one of the things that I'm hoping to be able to do is come up with a draft strategic plan and put it back out through community forums for people to look at and comment on. So keep an eye open for that as well.
Can I just say something?
Absolutely.
In relation to, we talked earlier about Heathcote Health Facebook or the website, so forth. That's a very, very passive way of interacting.
Yes.
I think if you're going to get out there, there needs to be something more active. Even if there was something in the main street that featured Heathcote Health News. I know that getting into the newspaper has been very useful too, but it's not put it on the website. What, in relation to other people who are going to attend, Sandra Slatter was supposed to attend. She just tried to ring me before, and something must have happened. But can I tell her to contact you if she's going to?
Certainly. Yeah. People, nobody should feel shy about getting in touch. It's everybody's point of view is important. One of the things that the board asked me to think about, and it'll depend a bit on what the government's restrictions do, is to a little bit later in the process, once we've got a draft strategic plan, to come up to Heathcote and do some community forums. So hopefully that can happen. I live in central Melbourne, so I've had a 5K limit up until just the beginning of this week. So and I would be horrified if I went to Heathcote and inadvertently seeded an outbreak there. So I'm you know, I understand why this is difficult, but we'll do our best. So back to you, Anne, to finish up.
Yeah, thank you, Alison, for that great facilitation, and thank you everyone for taking the time to come and talk to us and so generously share your ideas and opinions and enthusiasm. It's really great to hear that.
It's been great.
And I can assure you that we are listening, and your comments will feature, and the themes that we draw out will be part of the strategic plan that we're working on to create. I mean, I heard a number of really great themes coming out of today, about the need for connection in our community and the resilience that's fostered from those connections, about the importance of partnerships, and also the importance of leadership from the hospital sector. How maybe our plans might be a little bit dry, and that we shouldn't rely on digital passive ways to communicate, and we should think of, you know, ways to get out there and get our message to the community, because people, as we know, still don't know who we are. So what can we do to turn that around? And telehealth has been a boon for people as well. So we've got to find the good things as well. And when we get in early, we can make a really real difference in the trajectory of disease and public health. So those are some of the themes that I picked out from that.
I think that's a good summary, Anne.
Discussion. And so, yeah, so once again, thank you all for coming online, and thank you, Michelle, for your great organisation capacity. As Alison said, please fill in the survey, direct those who may have missed out. This consultation process carries on as we create the process. And yeah, thanks very much for your involvement.
Thank you.
Thanks, everybody. It's been a great conversation.
Thanks.
Thank you.
Bye.
Bye.
Bye.